Greetings, Bermuda. My name is Aaron Hill. As usual, I'm joined by my brother and good friend, Mr. Ryan Robinson, Parent Chief. Ryan, how are you?
I'm good today, Aaron, and it's good to be back on the COVID-19 special series with you.
Yes, I think we're both in different locations, so hopefully this works. So I think this is the first time I've been in this one and where you're at now. So hopefully we have a smooth run.
New studio.
Yeah, exactly, in our new studios. But as we start off every series, we'd like to express our sincere condolences to the families of those who have lost their loved ones to COVID-19. Tragically, we're now at 8 deaths here in Bermuda, and we'd also like to extend our best wishes to those who are still battling with this virus. And again, as we normally do, take this opportunity to thank our essential workers who remain on the front lines, protecting us and defending us. And to those medical students who are participating in the various labs. I think that's an enormous opportunity that they've taken out during times that they are still preparing for exams to volunteer. Ryan?
Yeah, so we have another special guest today. We actually have 2 segments of guests. So we'll be going to them shortly. But before we do that, we're just going to do a quick recap. On our last series, Aaron, it was a pretty good discussion we had with Glenn Jones, the interim CEO of the Bermuda Tourism Authority. Perhaps one of our best sessions yet. We had a lot of engagement from the viewers and the commenters on Facebook and YouTube, and we're grateful. So thanks again to Glenn Jones. Thanks to Bernews for allowing us to have this platform and the opportunity to meet and engage with experts and members of the community as we navigate the COVID-19 pandemic.
No, absolutely. That was, as you say, one of the best ones yet, as far as engagement, as far as between us, debate, as well as from the community, members of the public. Again, this is a reminder that this is a live feed. We are tuned into some of the comments that come through. So during the course of our discussion, and as we have our guests on, if any comments or questions arise, please do send them through, and there will be an opportunity specifically during this segment where we'll ask our guests. Ryan, I know that today we have, another heavy hitter on as a guest in Dr. Ricky Brathwaite, who is the CEO of the Bermuda Health Council. He's going to tell us a bit about what the Health Council's role is and how they've adapted to COVID-19. So without further ado, we'd like to introduce Mr. Brathwaite, bring him on screen into our studio.
Hi, Dr. Brathwaite. How you doing?
Doing fantastically well today.
That's good to hear. So health is a pretty heated topic, and we're grateful that you took the time out on behalf of the Bermuda Health Council to come and talk with us today.
Absolutely. We have a great team over here, so it allows me to take the time out to talk to you guys.
Okay.
So Dr. Brathwaite, before we begin, just a matter of protocol, do you mind if we call you Ricky?
Absolutely. My mom likes it, so I'm happy to share it with you guys.
Okay. I appreciate that. So as we start off, what is the role of the House Council generally? So some of our viewers may never have been tuned in before, know what the Health Council's role is. We have a Ministry of Health, and then we have the Health Council. Can you tell us a bit more about what you guys do?
So primarily, people think of us like the regulators of the system. So we regulate and license healthcare businesses. We look at the professionals who operate within the system and give them a registration. We also do things like help to coordinate programs for wellness and chronic disease. We currently have something called the Chronic Disease Innovation Fund, which we fund community efforts to cure or to treat chronic illness. And then we have a very special role we play as advisor to the Minister of Health to advise things around the health system and things that we can improve, such as the Bermuda Health Plan, which had been a topic of discussion. And during this time of COVID, we also are advising and providing some support for the Ministry and Department of Health and various units across the island on the response to this COVID epidemic, or pandemic rather.
It sounds like the Health Council has its hand in everything. So Ricky, who do you ultimately answer to, and who would you say that you represent as an organization?
So it's twofold. We answer to the board and we answer to the minister, but we also do the work that we do is ultimately for the people of Bermuda.
So when you say board, can you tell us a bit, is there a Health Council board? So this is similar to like the PTA?
Right. So the Health Council has a board that's appointed by the Minister of Health. Every 2 years, there's a board that's appointed. Currently, our chair is Dr. Wesley Miller. He's a surgeon over at the hospital, and he works as our chair. And we have a lot of talented and expertise within our board that helps us to create the pathway which we're going to do in terms of our projects.
Sure. So at the ministry, just by way of confirmation, it's the Minister of Health that, for example, does the board answer to the Minister of Health, or is it the officials such as yourself that answer to the Minister of Health?
So I mean, the board is appointed by the Minister of Health. I answer through the board, but the minister has, we have a collaborative arrangement between the minister and the board and the secretariat here at the council who does, the day-to-day work.
Okay.
Sure.
So talk to us a little bit about your role specifically. You've told us the role of the Health Council as sort of a regulator, as an advocate. What do you do on a day-to-day as CEO?
So as CEO, I mean, I help to create the vision for the organization. So for example, when COVID comes, I interact a lot with the incident command team and discuss ways in which our team can contribute to the efforts. So part of my job is to orchestrate the efforts and the skill of the team and put them in places to be successful and to ultimately contribute to what the community needs. So that is a big part of my role. As a background, I have a background in health economics. And so a lot of times when we talk about the financing of the system, or how are we going to deal with the uninsured population that we've been hearing so much about in terms of the economic impact of COVID, how are we going to deal with that? So one of the things that I do as part of my technical skill is to look at some of those measures of what are we going to look like when we exit out of this COVID situation regarding our healthcare system. But as I said, we have a great team here at the Health Council, a great team of young individuals who are contributing well to the efforts going on within Bermuda. And I always like to applaud them. And part of my job is to be their cheerleader because they do such great work here.
I'm glad that you mentioned that, as well as the pandemic, because that was going to be my next question, what the role of the Health Council has been in responding to this crisis. It sounds like the Health Council writes policy.
So we do write policy. Ultimately, it's approved through the cabinet and so forth. But during the specific time, we've been highly engaged with the care homes. We started back in January looking at the care homes and looking at ways in which they can be protected as much as possible. So we gave them training, we gave them guidance in response to the risk. We've also been doing things like procuring goods from China and the US for their safety. We've been meeting with them on a regular basis. We've been involved in the testing strategy conversations. We've been involved in how to deal with medical vulnerabilities in terms of keeping those who have, for example, severe cases of diabetes, keep them protected within their homes. We've been doing things like putting out infographics and education to the public. And all at the same time, there's been a lot of discussion around telemedicine. We've been putting out guidance for the insurers to cover telemedicine. So that's been a big part of our role. And I think it's been helpful to the public of Bermuda to have those options that we put out guidance for. So although we're a small team of 13, we've had a lot of influence and a lot of interaction with what's been going on around this COVID situation.
So Ricky, and I know you said that we can call you Ricky, but your actual title is Dr. Brathwaite. Is that a PhD or are you a medical doctor?
So I have a PhD in health economics. I also got a master's degree in bioengineering. So it's funny when we talk about real-time PCR with the labs, I always get this itch to get back in the lab and help with some of these efforts. And if I could, if Dr. Weldon would have me, I'd love to do some reactions. But no, they're doing a great job over there. I'm going to stay in my lane. But yeah, it's Dr. Brathwaite, but Ricky to pretty much everyone.
No, sure. So when we talk about, so for example, so you're not actually a medical doctor, but you happen to be leading a regulatory body, if you will, that regulates medical doctors. How many medical doctors are on the Health Council?
So technically, we actually don't regulate medical doctors, right? So the Bermuda Medical Council regulates medical doctors. We provide support for the other statutory bodies, including the allied health professionals, the pharmacists. We do have relationships, of course, with the Medical Council and the Nursing Council, but we're not directly in regulation of those. But in terms of our board, as I said, our chair is a surgeon. We do have an additional, I believe it's 2 additional physicians on our board as well. So we do have a good variety of knowledge base in terms of dealing with clinical issues as well.
So the board, again, I'm trying to understand for the purposes of our viewers who don't know anything, the board isn't actually the 13 members that you refer to in the Health Council, is it?
No, so there are up to 15 members that are appointed to our board.
Yeah.
Right. And then we, as the secretariat, who I'm the CEO or the lead of the secretariat or the team, we answer to the board. The board is appointed by the ministry, and the board works with the secretariat to advise and to do the things that the Minister of Health would like to see within the healthcare system.
So how many of your number of 13 in the actual health council, not the board, are actually medical doctors?
So we do have one medical doctor as part of our secretariat. We have a social worker. We have, again, we have myself. So we have a laboratory tech expert. So in terms of the healthcare system, we do have kind of reach in different areas based on the expertise that we bring to the table. But no, we're not full of physicians in terms of the secretariat, but we do have a medical doctor on our team.
What do you say to our viewers, some of whom are listening and saying, for example, you look at the Bar Council, if you will, that's a regulatory body that looks at or governs the legal profession. You look at other professions that have a regulatory body that actually have professionals from them. What do you say to individuals who say that the Bermuda Health Council should have more physicians on it?
Well, so then that would make a kind of an assumption that healthcare is only made up of physicians. So physicians play a role within the healthcare system. As I said, we have physicians on our board. We also have physicians within our team. But then if you think about it, Dr. Weldon or Aaron Evans, they're part of healthcare, but they're not physicians. So it's important to understand that healthcare is like a basketball team. You have different players playing different positions. And we play the same thing. So we have different expertise in different areas so that when we do come to the table, we can have a holistic perspective while appreciating the role that physicians play within the healthcare system. But it is important to realize that healthcare is a lot bigger than just a physician's office or a hospital. It includes medical lawyers. It includes the people who help to keep the operating rooms clean. So healthcare is huge, and we have to really appreciate all the aspects of it.
Ryan, I know that Dr. Brathwaite is a wealth of fountain of knowledge. So I know you got another question. Let me just ask this, then I'll turn it over to you so you can take over. Dr. Brathwaite, I know you mentioned that you guys have medical lawyers, and like that's actually interesting. Both Ryan and I are completing our legal qualifications. So does your team of 13 comprise of somebody who specializes, for example, in medical law?
So currently we do not have a lawyer on our team. Within the last 24 months, we have had lawyers on our team. We also do have counsel that we do go to when we have specific needs for interpretation of the law. And so we do have counsel. We also do work with the drafters and the policymakers within the government to ensure that any gaps that we have in terms of expertise within our team, we do fill them. What we don't do is assume that we're something that we're not, in terms of trying to make decisions based on information that we only have. If we need to reach out to different firms, we do that with expediency. So that's important.
So is there a role, sorry, Ryan, I said I was going to check with you, I will after this. Is there a role, for example, for like a young Bermudian who's interested in the legal aspect of healthcare, for example? Would it make sense? Like say somebody's graduated law school and they want to do a master's in healthcare or medical law, if you will. Is there a place on the Health Council for growth, for example, for that? Would that be a waste of, I know we look at things that were fun to learn and like, is that a waste of funds, or is there a space for, let's say, law students who are interested in medical law per se to have a role in the Health Council?
No, we are very proactive about reaching out and having people join the team, because what we provide to anybody is a huge eagle-eye view of the healthcare system, right? You're not going to get this kind of view from working anywhere else within most countries, because we have this huge view and we're able to touch different sectors. So we've been in discussion with Bermuda College on how to create a internship program. We have had internships both during the summer and during the other parts of the year. So anybody who's interested in providing or getting some experience within the healthcare system, feel free to reach out to me, reach out to our team. It's healthcouncil@bhec.bm. We will put the money aside to invest in our future. One of the things I'm fully for is investing in our future generations, which is probably what you see reflected within the team here at the Health Council. On average, we're probably around 32, 33 on average within the Health Council. So we have a pretty young team that are doing very important work. So to think that we're in such a position to influence and to impact policy means that there are very passionate people within our team, and we're always looking to bring on additional individuals to take our places as we age.
No, sure. And that, I think you've answered what was going to be my next question, which was what development opportunities you have for young people. But I'm glad to hear, that you are open and willing, and that you are a young council. For the most part, your average age, as you say, between 35, if you will. So that's good. And I encourage young Bermudians who are tuned in, who have an interest in healthcare, to reach out to you to see what opportunities arise. Because contrary, that's news to me, for example, that you would think that a health council is restricted to, let's say, the medical practitioners.
Right.
And so it's good to know that you've got different fields of people that can play a part and a role in the health council. Ryan, over
Absolutely.
to you.
Sure. So, Dr. Brathwaite, you mentioned a little bit. I mean, we know that the Health Council is a regulator, an advocate. You draft policy. To our viewers and to many people, that might seem sort of macro, bigger picture stuff. Talk to us a bit about the involvement that you guys have had in the day-to-day lives. How does that impact sort of the Bermudian on the street or the average viewer right now? We've seen things like the Health IQ website. You mentioned helping out with getting testing kits. How does the Health Council have a direct impact on some of our viewing listeners?
So one of the things, and I'll be very specific. So when someone calls and says the health insurance company doesn't understand my case right now, can you help the advocate and talk to them about covering this care? We'll pick up the phone and call the claims department and have a conversation about ensuring that that person has coverage. When someone isn't receiving insurance through their employer, we'll pick up the phone and call the employer and either make sure that they're complying with the law or take it to the legal courts if need be. If there's an individual who needs a medication, we'll reach out to the pharmacies and say, hey, we have this person who needs medication. Is there something that you can do for them? So from an individual standpoint, we do a lot when it comes to advocating and supporting each member of the population here. We have this thing called complaints and queries. If people aren't satisfied with some parts of the healthcare system, they call us, they give us their complaint or their question. We reach out to whomever. And one of the good things that we're in a position to is to be able to reach out to whomever within the healthcare system and have them pick up the phone. And by having them pick up the phone, we can get the answer to the question that someone may not be able to get to themselves. So we are very passionate about the individuals within our healthcare system. I think anyone who goes into healthcare has to, in their heart of hearts, have to have some interest in the well-being of their fellow man. And to the man and woman within the Health Council, each person of our team has the same kind of passion and zeal. To the point where they sometimes get upset at me by saying, why couldn't we do more, right? And that's so often the question, can we do more? Can we do more? And of course, part of the reason we can't do everything is one, we don't want to step on other people's toes because we don't have the mandate to do everything. And sometimes budgets won't allow us to. But for example, we went during the fall, I believe, we did a drive around giving out fresh fruit and vegetables to the public. And we thought that was just our little way of giving back. I've said this before, it may not have hit or touched that many people or changed lives, but the smiles that some people who got that piece of fruit in the morning made all the difference in the world to us. And I think it was that kind of demonstration of community fabric and societal kind of coming together that's important to every member of the Health Council team. I'm
glad that you mentioned that. It really does seem like the Health Council is sort of an advocate for the Bermudian on the street. You mentioned insurance companies, and I want to pick your brain on our healthcare system in just a moment. But before we get to that, talk to us a little bit about this new platform that you guys developed, Health IQ. What is it and what does it do?
Right. So Health IQ was born out of the brainchild of Lee MacArthur and 18-year-old Gabe Daniels. One of the things that they brought to the table was this idea of collecting local data to be able to track and be proactive in tracking symptoms of COVID-19. One of the things the Health Council said was, wow, we can really use this to do even more based on our position within the healthcare system. So healthiq.bm is a new platform for anyone to put in their symptoms, to put in whether they're healthy. And by that, we'll be able to get more local data to be able to transition from phase 1 to phase 2 to phase 3 to phase 4. As I said, one of our biggest points is advising the minister and in extension advising government. So if we can provide adequate data to the government to make decisions on policies regarding reopening our economy and so forth, we will do that. Data is an important part in making any decision, and the more local data that we can have, the less we have to rely on international data to make decisions.
That's good to hear, and I'm glad that you mentioned that there were young Bermudians involved in the team as well. That definitely sounds like one of the examples of sort of how the Health Council helps the average Bermudian on the street.
Yeah.
Talk to us a little bit about the healthcare system. You mentioned insurance. You mentioned persons who, for example, don't have proper coverage. This COVID-19 pandemic is obviously going to have a huge impact on the hospitals, on insurance companies. You mentioned telemedicine. What are you guys thinking? Did you draft the original proposed government healthcare plan? How does that change now, and what are we looking at going into the future?
Right, and before we get to that topic, it's Gabe Jones. I didn't mean to. It's important to recognize properly our 18-year-old.
Yeah, thank you for the clarification. And I'll also point out before you answer that we have some live comments. We have 2 segments today, so we won't be on with Dr. Brathwaite too much longer. But if the listening public have any questions, you can start rolling those through. Go ahead, back to you, Ricky.
Yeah, so on top of things like Health IQ, we have been involved in things like the Bermuda Health Plan, so the establishment and the creative thinking behind it. So the goal of the Bermuda Health Plan has always been to how can we improve the health insurance coverage and health insurance system for everyone within the system to have some equity and fairness within it. What we found is that there has been some disparities over time. Different people get different access to care. And from a basic level, we believe it's important that everyone has a basic access to important care, including primary care, hospital care, things like going to the dentist, going to the getting your eyes checked. There are some fundamental things that we believe that everybody within the healthcare system has. So the Bermuda Health Plan is a platform or a product that we're trying to put out to everyone in the public. I know that there's been a lot of controversial discussions around can you afford to give all these people all this care that's been proposed. And so we went through the modeling of the plan and through the numbers of how much it would cost. And we worked through a product that everyone that could be fit within the premium that was stated. So what happens with COVID? So of course, within every system, the amount of money that you have allows you to do things. What's happening with COVID is people are losing work or losing jobs and therefore losing health insurance. And that health insurance premium that they would pay into this pool of money that everyone has to be able to spend on different services, that money is going away. So what we're trying to understand is what the ultimate impact of having fewer insured people and fewer contributors to this money pool to be able to provide services to everyone. What it can, in a extreme case, what it can lead to is a situation where those who don't have insurance just don't get it. Those who continue to have work get it. And I don't think that's fair from a country standpoint that we get into a situation where it's only those who can afford get the kind of basic healthcare services that they need. It just becomes a disaster when it comes to building a healthy population.
If I could interject right there, you raised an important point, which is not every country has this situation, but I know Bermuda does, which is that our healthcare insurance for most people is tied to our employment. So right. If somebody is losing their job right now, which a lot of people are, thousands are, that means thousands of people who are uninsured. Now, some people have said that after this, because of the government going into debt, for example, there's no way that we're going to be able to switch to a system where government is taking more of the burden on or shouldering healthcare for other people. I'm wondering what you think about that. The proposed healthcare plan before COVID-19 was sort of a hybrid system, so I've heard. It wasn't universal healthcare, it was unified healthcare. How does that change? And if that was the case, if we're understanding that a lot of people are uninsured right now, why wouldn't we go just for universal healthcare rather than unified healthcare? And was that your decision, or was that sort of you writing policy based off of the recommendations that were given? Just flesh out and talk to us a little bit about the thinking surrounding that process and what it means for Bermuda.
Right. So remember, the unified model is a process or a way of actually funding healthcare. It's not the total package when it comes to kind of universal coverage or universal healthcare. So the unified model says find certain benefits and pay for them collectively as a community, right? And so those set of benefits are called the standard health benefit. It's neither here nor there, but they're basic benefits that everyone's being asked to contribute to. Right now, for example, the hospital is being funded through a contribution from everybody who's insured. That's the way the hospital is being funded. If you think about it, if under this current situation, no matter which system you use, if you don't have the funding to support it, you're going to have a problem accessing services. So what we have to get to is a better economy. We have to get back to a normalized economy as quickly as possible, so as many people can contribute. Because right now, within the status quo, what's going to happen is, as I said, some people just won't be able to afford their healthcare if they don't have money coming in, and that's a problem for everyone, right? It doesn't matter whether it's tied to an employer or not. Even if you're a person who it wasn't tied to employment, if you don't have the disposable income to afford health insurance, you'd be in a situation where you don't have health coverage. And so it leaves it up to whether you have money to shell out of pocket, and whether there are systems or programs in place that will accept the amount of money that you have, regardless of how much it is.
Mm-hmm. I mean, you mentioned when we talk about, for example, somebody who's unemployed, not getting health insurance, right. That sounds like a sort of a every man for himself model, right? If I lose my job, then I lose my health insurance. Whereas somewhere like the United Kingdom, it doesn't matter whether you're employed or not. Everybody has access to universal healthcare. So even though you raise an important point, which is that ultimately you're going to need funding for whatever system you use, certainly a system whereby everybody is covered regardless of whether they're employed or not would be one that might be easier to fund than a system where every man is for himself, if you're talking about trying to get everyone coverage. What do you think about that?
So I definitely agree. So one of the biggest parts of the Bermuda Health Plan was this collective thinking. How can we, even for those who aren't insured, how can we contribute as much money to a pot where even if you're not insured, you can benefit from the services? So when we talked about primary care and saying primary care would be funded through the Bermuda Health Plan, it wasn't just for those who were insured, it was also for those who were uninsured. Understanding and assuming that there would be some willingness within the rest of the population to fund for those who don't have. So I'm totally on board when it comes to understanding there has to be a balance between those who have being able to take care in some ways of those who do not have as much. And that has to be part of, at least from my perspective, that has to be part of every decision that we make, understanding that if we don't provide for those who do not have, ultimately those people suffer, and ultimately those who have will have to pay for that just in a more expensive way. Mm-hmm. So the sooner we can get to kind of interventions for those who do not have and give them the supports they needed, the better for all of us.
So with that logic, right, it seems like the proposed system prior to this pandemic was one that was sort of trying to find that balance and please both sides, if you will. If we're talking about trying to cover everyone, why not just go for universal healthcare altogether? And I want you to clarify as well, whether the Health Council, was this a plan that you initiated and sort of advocated yourselves, or was it something where it was sort of handed down to you where you were told, find a way to please, the insurance companies as well as cover everybody as much as you can? Or so I guess there's two questions in that, which is, why not universal healthcare as opposed to this unified system? And secondly, what role does the Health Council play as far as actually driving any particular strategy or policy over another?
Right. So we'll advise based on existing information. So in 2011, there were plans that were drawn up. I wasn't at the Health Council in 2011, and neither was most of the team. So what we're doing is advising based on the information that's, I wouldn't say handed to us, that we have sight of. And then we provide advisement on that information to those who are making policy decisions. When it comes to whether we were pushing, we are always part of the discussions when it comes to healthcare and health system things. I think what we've been pushing more so than kind of a plan is the concept of how do we ensure that people have the basic rights to health and access to the services that will get us as a population healthier. it doesn't matter holistically how it's built on top of that, as long as we can ensure that and that we have the money to afford it. So based on those kind of criteria, the Bermuda Health Plan or the unified model at this point in time was seen as the most feasible model. That doesn't mean that that there is no interest in going, and tweaking things based on the current economic situation or the current, number of people who are employed or unemployed. We have a big range of things that we need to consider now that COVID has presented to us this different world. And it would be foolish of any of us to not assume that things need to be tweaked or refined or reviewed based on the change in our situation.
Yeah, I mean, you mentioned tweaking things, but some people are suggesting that tweaking things has been the problem all along, right? Is that we're sort of trying to fix a system that maybe needs to be replaced altogether. So when you mention tweaking things, where do we strike the right balance, and why, for example, would we choose one system over another?
Right. So you mentioned kind of a universal system, and I assume what you're meaning is more like a Canadian system or NHS or one that's funded through kind of pooled taxation.
Right, the system which makes sure that everyone is covered regardless of whether they're employed or not.
Just not understand, but just realizing the current situation is that we don't have a tax-based funding system when it comes to those kind of social services. So with our current system, what we do have is premiums. And so how do we use premiums as well as government grants that they provide and the funding that the government does to ensure that we have, we don't disrupt the system to the point of not knowing all the unintended consequences and leading to positions where we can't keep it stable. How do we create a new system and an improved system without breaking it down to the point where it's not sustainable? So there's a balance between the two. You can't just overhaul a system by putting a new system in if you aren't also looking at the inputs as to how to make that system work. So there's a lot of conversations that still need to happen. I think everyone's up for continuing the conversations and continuing the consultations around these things. But you do raise an important point, and in some ways, I always wonder the different views of different segments of our population. There are those who have been established in the system for a while, those who may be younger, who may be more revolutionary in terms of overhauling. And how do we also strike the balance between, what our population, kind of their preferences are as well? Because ultimately, it's the people who have to live within whatever system. And so sometimes I've made this point before, and we've been trying to be very proactive in ensuring that we get the kind of voice of the youth. Often the youth aren't as engaged in the conversation as they should be, because at the end of the day, if they're not involved, whatever results of the system that they ultimately have to live with, it's them that has to live with these decisions. So we try to get as much involvement as possible for those who are 18 and 40, get them to the table, get them talking about these kind of important issues.
Absolutely.
So, Ricky, can you tell us a bit about what the Health Council is doing to cut the cost of healthcare? We've heard, these large figures, annual figures for the cost of healthcare per year as a jurisdiction. What is the Health Council doing to actively reduce that?
Well, so you brought up the point. How do you know about the figures of how much we're spending? The Health Council puts out that report. So the Health Council does measure the amount of money that we're spending. Has been trending this for the last 12 years, I believe. And so we've seen the growth. So we're very aware of that. So on a macro level, the biggest thing that we can do is get healthier as a population. That's going to be the biggest bang for your buck over the long term is getting healthier as a population. So as I said, we're also responsible in some ways for creating some wellness programs and helping to ensure that coverage for programs that will lead to better population health are in place. In addition, when it comes to things like the standard health benefit, which is kind of the foundation for our healthcare system and our insurance system, what we've been doing is putting in benefits that are cost saving. So in 2014, 2015, we put in the home medical services program, where services that were usually only done in the hospital can be done at home. We saved hundreds of thousands of dollars through that program. We looked at prescription drugs. We have a prescription drug program that we have as part of our home medical services that has saved hundreds of thousands of dollars through that program. And one of the biggest things that you would have heard over time is the Health Council being involved in the setting of fees for certain services. So one of the ways that you do control the rise in cost is through some regulation of fees. What we're intending to do over the course of the next few months is to put out some more guidance and some more information around transparency in the fees that are being charged, so that at least people have an opportunity to make decisions around which provider or which service to get based on at least having some more information around cost. And so transparency is important, and public health kind of initiatives are important as well.
Sure. So you mentioned two things I want to follow up on, and that's the pharmaceutical aspects, the drugs, and then also the cutting of the fees, or regulation rather of the fees. So perhaps we can start with the pharmaceutical drugs. I'm aware of a provision in the schedule that's a provision of the Pharmaceuticals Act here in Bermuda that prevents, for example, the importation of generic drugs from India. Can you explain a bit of the rationale? Because I remember personally, and I can disclose it because it's me, that going to the pharmacy and basically they're telling me, well, this is the generic and this is free. And the actual name brand drug was some $100 and something. What is actually the difference between the two, and how do we, for example, if I can get a generic drug that's free, if we could do that across the board, why do we have a provision here in Bermuda that prevents that?
So there's 2 points you made around importation and where we can kind of get drugs from. So one of the things that the law says is if it can be sold in the U.S., Canada, or the European Union, it can be imported to Bermuda. That doesn't mean it can't be manufactured in India or in Israel. It just means that there has to be a supply chain that drug can be sold in one of these other jurisdictions. Part of the reason why we do that, and it's more so the office of the chief medical officer who manages this part of the regulations, is to ensure that there's at least some accountability and some way to track quality. So if it can go through the regulatory rigors of the U.S., Canada, and the EU, then it's assumed to be safe for Bermuda as well, because we don't have the same regulatory framework to be able to test all the drugs that come in to ensure all the same quality. So we rely on another jurisdiction. In terms of the other question around generic drugs, an interesting statistic that we've run here at the Health Council is that on average, 55% of the drugs that are used in Bermuda are generic, right? So we do use a majority of our drugs are being generic, but here's the other part of that. In the United States, they use about 91% of the drugs that they prescribe are generic. So understanding that typically generic drugs are less expensive, we're not getting the optimal kind of value for using generic drugs. When we look at different countries around the world, we have this huge gap of money that we can probably be saving through generic drugs, using more generic drugs. So part of our role would be to put together guidance around the use of generic drugs. 2, we're actively working on the creation of a drug formulary to ensure that there is some price regulation around drugs in general. We're also looking into procurement to ensure that there are better ways, or if we can find more efficient ways to procure drugs for less expensive prices, we need to get those on island. What we have as a limitation as an island of 64,000 or 63,791, if I'm correct, is what we have is a small buying group, right? And so one of the things that we don't want to do is segment that group even smaller. So in some cases, if we can negotiate based on supply for whatever 60,000 we need, it's better than having multiple people procuring for smaller groups within that and not getting the best price. So we have to look at strategies for procurement that are going to be smart, going to be innovative, going to be technology and evidence driven. So one of the things that we are actively doing, and we've already submitted some of this paperwork to the ministry for review, is around drug formularies, and with the notion that a lot of the questions that we get from seniors in specific is how can they get better value or be able to afford the drugs that they need. So part of it is the coverage of the drugs and how do we get drugs for cheaper, and then the other part of that equation is how do we get seniors or people in general to age more healthy? So because we can't just deal with it on one hand, we have to deal with it on all the different angles that we can address some of these issues. We have to try as many things as possible to get our healthcare system in a more sustainable position.
I'm glad that you mentioned that, because we had a comment from someone earlier, Delcina Bean Burrows, who said that a big part of managing healthcare costs is to keep the population healthy, no matter what system we have.
Right, and there's been a lot of conversation about kind of the whose role of it is it to keep people healthy, and I would posit that the government plays a role, our community organizations play a role, and individuals play a role. So it's a tripartite kind of thing that we need to always keep in our minds, that it's not just about the individual. And there's been kind of this culture in some ways of blaming the individual for not keeping themselves healthy, right? And laying blame at someone's feet. It's not just individuals, it's the community and it's the government. We all have a role to play. And the sooner we can get to this realization that we all are in this together, the better we are going to be in terms of getting our population healthy. It's not good enough to say, well, it's their problem, right? Or it's her problem or it's his problem. It's all of our problem, right? Our families are affected. When I receive a call on the phone and says, my family member X, Y, and Z can't get care or is in a horrible position right now, it's not a matter of, okay, well, you the family take care of it. We reach out to partners and say, can we as a collective help this family get through their struggles? And that's something that we need to do more and more of as a collective, and be more collaborative in how we address our healthcare issues.
So the second part of what I wanted to discuss was with respect to the regulation of costs. We know that our highest cost of annual healthcare as a jurisdiction is the hospital. Particularly now that we've got COVID-19 and we know that the hospital resources are going to be stretched to their limit. What do we look at? I mean, let's look at, for example, let's start with pre-COVID-19. What steps have been taken, or can be taken or ought to be taken by the Health Council to reduce, for example, that enormous expenditure that is allotted to the health or allotted to the hospital? And for example, we talk about like regulation of fees. And when we talk about regulation of fees, we think of doctors. And you've made very clear that you don't actually regulate doctors. That's the job of the Bermuda Medical Council. But doctors, correct me if I'm wrong, make up a small portion of our annual healthcare cost. Is that true? So
yes, the hospital does take up the largest proportion of the healthcare costs. The second would be around the professionals, including the physicians, the dentists, and so forth. I wouldn't say any of these numbers are insignificant. What I will say is that in general, we need to address all the different aspects of the system, including what the hospital has done and is expected to continue to do, is look at their efficiencies. Right, they've put savings plans in place, so they have done some efforts in terms of reducing their spend. But also remember, the hospital employs about 1,800 people, right? So when we talk about reducing the spend in the hospital, we're also talking about reducing the livelihood of some individuals. So we can't just say that there are two different kind of conversations that take place. Families are being supported through their payment and their work in the hospital. If we want to reduce the size of the hospital and therefore diversify what people do outside of the hospital, then we need to train individuals to do other things outside of the hospital. We need to grow other industries. And then we need to then allow us to reduce maybe the size and the spend on the hospital. But we also need to do those other things. You can't just say, well, hospital, reduce your spending, because they're already trying to do that. But then you get into the point of, are we talking about reduce your workforce?
Mm-hmm. If I could interject, Aaron, really quickly, sorry.
Well, just a second, Ryan, just a second. While we've got Ricky on that trend of thought, with respect to the hospital and the cutting of costs, for example, for our listening audience and for me, really, so I'm asking this question, I don't know the answer to this question, right, Ricky? We've heard of the Bermuda Medical Council. We know that we've got a Ministry of Health. We've got the Bermuda Health Council. We've got, for example, for our highest level of expenditure, we've got the Bermuda Hospitals Board. It seems to my mind that we've got, for example, 5 heads that deal with healthcare. And we know that the individuals who lead those heads make some hefty salaries. But then you've got decisions. For example, you give guidance to the minister. We've got a board at the Health Council. The BHP has a board, and then they have an executive team. So we've got a lot of individuals who are playing an important role, that's a given. But what do you say to, and I'm suggesting this, so I'm not saying that anybody else is, that we consolidate, for example, and is that part of a universal healthcare model, consolidating one body that's responsible for healthcare, and they have various subdivisions in that body to allow for some type of team cohesiveness, or a reduction of the cost, but still maintaining that efficiency?
Well, Aaron, I don't even need to ask my question after that, because we were on the same line of thought, and I would just tack my question onto that, which was, well, Dr. Braithwaite, you mentioned cutting the healthcare costs might mean laying off, or getting rid of some of the hundreds of Bermudian workers, or affecting them who are working at the airport. But there was also recent reports out about some of the salaries, for example, of the executives at the hospital, and there was a lot of controversy surrounding that. So, Aaron, you asked the same question I asked, and I just wanted to add that piece onto it when Ricky gives his response. Thanks.
Sure. So the Bermuda Health Council was put in place to kind of serve as this coordinating body, right? So exactly what you're talking about was the intent of the putting into place the Bermuda Health Council. You're also asking the question around whether the boards can be kind of combined to have one holistic view of healthcare. The Bermuda Hospitals Board, like any other hospital, plays an important and critical role, and the types of work that they do require complex, both complex staffing and complex decisions to be made. So to expect those kind of decisions to be made, in addition with kind of overseeing the healthcare system at the same time, would be asking a lot of a huge board that would need a huge number of members that at that point in time would probably not be functional on a realistic standpoint. So it's important that the Bermuda Hospitals Board has oversight and has a board. But just in terms of the core of your question, does there need to be an oversight body who helps to orchestrate the healthcare system and keep it running smoothly? That's what the Bermuda Health Council
well, just by way of clarity, right, Ricky? What I'm saying is we've got, so let's put aside the hospital board. And I actually thank you for that clarity, because it makes sense to me why the BHP would, notwithstanding anything that I'm going to say, need to be responsible for the health or for the hospital itself. So I appreciate that clarity there. I'm referring to, for example, we've got the Ministry of Health, we've got the Bermuda Medical Council, and then we've got the Bermuda Health Council. So those three bodies is playing similar, if not distinct roles, different. And I know you're going to say that they're different roles. What I'm asking for those three bodies within themselves, could we not consolidate that? Because you're giving guidance to the Ministry of Health, who under the Ministry of Health falls the Bermuda Medical Council.
So remember, Bermuda Medical Council is a voluntary council. So it's not a council that gets paid as though they're a company. They're a voluntary council whose memberships have day jobs, per se, doing the work of caring for the residents of Bermuda. The Ministry of Health, their major role as a government entity is to provide legislation, to provide those kind of higher level conversations around how the country goes in terms of health and the policies around health. The one thing about healthcare, and I think it brings us back to the initial question as to why don't we have, in essence, why don't we have just physicians in the Health Council? Because healthcare is such a complex thing. It touches every part of our healthcare, of our lives. It is involved in all the decisions that are being made. Healthcare is part of everything that we do. So I think it's important to understand how complex healthcare is and the importance to have people playing certain roles to ensure that it's done right. So the ministry has a huge role. And also, I think it's important also to note that none of these boards or these staffs are full of people, right? We're not talking about huge numbers of people and huge numbers of resources. So we have to be strategic on how we place certain people to do certain roles and play the roles in as deep of a way as possible. So I don't know if it actually would work if we were to combine all these different things, because what you end up doing is just have different departments within a larger body, which is in essence how we work now. We just have a more of a autonomous structure so that we can have some balance and checks and balances between the decisions that are made and some kind of insights and spend some time gaining insights that one of the other partners may not have. I understand your question. It's a fair question to raise.
What do you say? What do you say to? I mean, this is another one for me, really. When you mentioned, and I didn't know that the Bermuda Health Council was a voluntary body. So that's actually interesting to know.
Bermuda Medical Council.
Medical Council. Sorry, no, not trying to take away your paycheck there.
No.
But the Bermuda Medical Council was a voluntary body. So I didn't know that. And it begs the question to my mind as to whether or not the individuals who regulate a profession should be actually independent of those who they regulate. So should the regulation of doctors be a role for the Health Council, for instance? Because, for example, if I'm at the Bermuda Health or Bermuda Medical Council, rather, we want to get that right, and I'm regulating other doctors, perhaps my decision is influenced by the fact that I know that my decision could have a financial interest in the disciplinary or otherwise proposals that are made to the Bermuda Medical Council, because I'm actually, as you say, I have a day job, I have an interest.
Right. So I answer that question. The Health Council is happy to be supportive of any regulatory efforts within the healthcare system. So we do have expertise in a variety of areas through our board and through our secretariat. If we're asked to help and support the Bermuda Medical Council in any efforts that they may need to fill in gaps, we are happy to do so. Same thing with the Nursing Council, same thing with any other statutory board. We're willing and happy to provide any supports. It's very important that the Bermuda Medical Council and any profession has the ability to kind of to police themselves, right? So I wouldn't want to take that away from any of the statutory bodies. We don't do that for allied health, for dentists. We want them to police or to kind of keep themselves or hold themselves accountable. But in a way, they always can reach into their toolkit and pull out the Bermuda Health Council and say, hey, can you help us with something? We're more than happy to help.
Last question from me, and then I'm going to pass it to Ryan. I know we're going to wrap up, and you mentioned the Bermuda or the Nursing Council. We've got some nurses on the line who are going to come on after you. Thank you for your time. My question, when we talk about the regulation of various professionals, and you mentioned like the allied professionals and the like, I know in Bermuda, for example, some professions are not regulated. Like we've got, for example, chiropractors. Are they actually now regulated under the Health Council? Or, for example, like sports massage therapists, are they regulated under the Health Council? Do they fall? I know they fall under the category of a health facility, so to speak. Right. But what are some of the unregulated professions, like acupuncture, for example? And what is the Health Council looking at? Are you looking to regulate some of these professions? So
you've noted, some of the unregulated professionals, and so there is a process by which we're trying to ensure that people have some association. So everyone should have an association or a body to report to. We're helping some of these professions who don't have that established to establish them. Then they'll set standards. And then what needs to happen is them to go through a legislative process by which there is an appointment of a proper board and oversight from a legislative standpoint so that they are no longer considered unregulated. We've been helping whomever comes to the table on that process. We've also been proactive in reaching out to some of these professions and saying, hey, we can help you to get regulated, because what we all need is trust in the system to ensure that there is some accountability that everyone has without being overly prescriptive and saying this is how you need to do something. But at least we need to know that there's some standards that everyone's adhering to. And as a big part of our role is to ensure that we are in support of doing that for unregulated and regulated professionals alike.
Sure. Well, Dr. Brathwaite, thank you very much. And we've had a pretty good discussion so far. Aaron, I think we've touched on pretty much everything from the healthcare system to what the Health Council does. And then at the end of that discussion, we talked a little bit about how we can sort of streamline or save costs. I had asked a question about salaries, but I am cognizant of the fact that we've had you on here for an hour, and we need to begin to wrap up with you as we have other guests waiting. But what I would ask you, I guess, parting words, Dr. Brathwaite, what can we be doing differently? It's a tough time. We've had some questions here from Gina Spence about what happens to people now that, they're losing their insurance benefits. We've had some questions from Aaron about how we can perhaps consolidate and reduce costs. So I guess you can factor that into your answer. But overall, thank you. You said you'd be very direct with us. What should we be doing differently? What are your parting words for the future?
And before you answer that question, when you're finished answering, if you could just give that email, because young people are listening. You mentioned an email earlier that people can reach out to.
Yeah, maybe we can get it up on screen. Yeah.
Yeah, that would be great.
So maybe I'll do that first and last, since I think it's very important. Health Council at bhec.bm. That's Health Council at bhec.bm. Feel free to email us about any opportunities that you may want to kind of engage or get exposed to the healthcare system. So what can we be doing better? I think this is a prime time to discuss this or to kind of reflect on this. We can communicate better. I know that seems simple, right? But everything that we do within the Health Council and within the health system relies on good communication. So from communicating with your physician, from physicians communicating with their medical council, to all this kind of communication. If we can get communication right, we'd be saving ourselves a lot of money, a lot of heartache, a lot of a headache, and a lot of just time wasted. So if there's one thing that we can do better as a healthcare system is communicate better. And again, that's Health Council at bhec.bm. Again, anybody, as long as your parents will allow you to come out the house and do something good for your community, we're willing to have you. So,
and bring your mask.
Yeah. Well, thank you very much. This is Dr. Ricky Brathwaite, the CEO of the Bermuda Health Council. Like I said, you told us that everything was on the table, and I think we got a good range of questions. Thank you so much for your direct responses and answers. It was good to pick your brain. Thanks for joining us.
Can I say one last thing?
Sure.
It's actually good to see you guys doing this as It's good to see you guys doing this, and it's good to see that we have men such as yourself leading the way and providing some insights to the community on topics as important as these.
Yeah, you as well. We had a comment by Gianna Bryce that said, good questions and good answers. So we definitely could have done it without you either. So thank you very much for joining us, and enjoy the rest of your day.
Thank you.
Take care.
Well, Aaron, I mean, that was a pretty thorough discussion, I would say.
I think that he said we can call him Ricky. I think that Ricky might have heard us commend Glenn, the CEO of the Tourism Authority, and he was running in to compete for the best one yet.
Yeah.
And I'm grateful for his candid responses and the answers. He comes across as a very genuine individual who does care about what healthcare is all about, which is the people of Bermuda.
I like that we got to talk a little bit about what the Health Council does specifically, but then you also asked some questions about, cutting costs or perhaps streamlining things, because, at the end of the day, Aaron, this crisis is going to have a big impact, and people are going to be looking to make cuts, number one. But number two, there's a lot of people uninsured that are going to need coverage. So sorry to cut you off there, but I just thought that was a good question you asked.
No, and I think that one of the things that we can come to ask some other professionals in the healthcare industry. I thought that Dr. Brathwaite provided excellent answers to the consolidation issue. I didn't know, for example, that the Bermuda Medical Council was a voluntary board. And that raises some questions. Should they be? What are we expecting our professional, or should that be a task assigned to the Health Council moving forward? So again, we're grateful for, I think the purposes of some of these interviews, especially when we have experts in their field, is to get the information. And then we can have a discussion and say, based on the factual information we've received from the experts, what direction do we want to head in? I know that we have backstage, we have 3 nurses who are part of the Nurses Council here in Bermuda, Ms. Gaynette Hayward Caesar, who is the Chief Nursing Officer for the Government of Bermuda, Ms. Janice, and I hope I'm saying this right, we'll ask for a clarification, but they're going to be brought on screen as I'm calling out their names, Ms. Janice Seeley Khan, who is a registered nurse at the Department of Health, followed by Ms. Luz Lambert, who is responsible for personal protective equipment training. Pleasure to have you.
Hello. Thank you. Thank you for having us.
Good afternoon.
Okay.
Can we just start off by getting everybody? I've called out everybody's name for our listening audience.
Yeah, before you do that, I just tell for the nurses that aren't speaking, it sounded a bit like a party in here. If you just mute your mics when you're not speaking, and we can just go one at a time. I see some balloons in the background. It feels like a party. Mrs. Gaynell Hayward Caesar, the Chief Nursing Officer. Why don't we start with you?
Yes, good afternoon, gentlemen. I am Gaynell Hayward Caesar, Chief Nursing Officer of the Department of Health. And it's so wonderful to be among some kind gentlemen this afternoon. Pleasure.
Thank you very much. We're glad to have you. Mrs. Janice Seeley Khan.
Yes, good afternoon, Mr. Ryan and Mr. Aaron. Thank you for having us. Also, good afternoon, Bermuda. It's certainly a privilege to be here, especially today, which is the International Day of Nurses. So I want to say hello and congratulations to my fellow colleagues locally and overseas.
And last but not least, Miss Luz Lambert. Am I saying that right?
Correct. Yes, it's Luz Lambert. You might want to mute yours. Me and Gaynell are in the same room.
Oh,
Social
that
distancing,
explains
of course. I think that's why you can hear an echo. Yes, I am here today. Happy Nurses Day to all the nurses on the islands and overseas.
Well, thank you very much for joining us, and welcome to all three nurses. Happy International Nurses Day to all of you. We see some of the comments rolling in as well from some of the general public. It's a timely moment to have you on here. I'm sure your job is no easier today than it was before. Aaron, I know you had some questions for the nurses, but maybe we can start by asking them how they're doing.
Nervous? Can we be honest?
No, absolutely. Please do be honest. We're live on Facebook. We've got a few hundred people tuned in, listening to us, but not to worry. It's a new platform for Ryan and I. We're getting used to it. It's a new experience. This, for example, is very new for us because we never had 3 guests on as well as Ryan and us. So we've got 5 of you on at the same time. So, feel free, no pressure. Knock on wood, no pressure. Yeah. I didn't know that today was International Nurses Day. Again, I see that the sign in the back there, Department of Health, Nurses Rock. Yes, you do. You're all essential workers. So we would like to start off our interview by thanking you all for being out there on the front lines, protecting us all and doing your part in, protecting us from this virus. If you could just tell us a bit about your experience, we can go one by one, your experience so far in the COVID-19 era, what that has or how that has shaped your individual realities and the jobs you play.
Yeah, and I know Mrs. Gaynell dropped off. If she doesn't come back, maybe we can switch back out between Luz. Okay, there she is.
Right there.
Never mind there. Back to Aaron's question then, sorry.
Okay, well, I can actually start off, Aaron, if you don't mind.
Yes.
Okay, well, actually from January, I was charged to sort of implement our respiratory protection program. Our boss, Ms. Hayward Caesar, she actually asked myself and another colleague, Nurse Diane Moore, if we can sort of get this respiratory protection program, up and running. So we started to do something called fit testing. I'll get into that in a minute. Yes. But of course, the COVID-19 happened. So we really had to jump on board with our respiratory protection program. And as you'll hear later from Nurse Luz, she also, joined in with the the personal protective equipment.
So can you while you're on that, I mean, because I know that we're going to have some technical difficulties with switching and muting and unmuting. While we have you, can you tell us a bit more about what that is? What is this fit test?
Yeah, certainly. It'd be my pleasure. Well, fit testing, actually, it's not rocket science. It tests to see how well a seal is formed between an N95 respirator mask and the wearer. So as you see, we now have to protect staff from this COVID-19 or any airborne respiratory illness. So we cannot allow staff, nurses, and auxiliary staff to go into an environment that they would be, they will come down with these airborne illnesses, and not just the COVID-19, but that would be SARS. Remember, we had Ebola, tuberculosis, even something as simple as childhood measles. So when they're scheduled to do fit testing with me, it doesn't guarantee that the N95 mask that I have will fit the individual. So what it is that I connect them to a machine, which is called a port account. And then along with my laptop, there's a software that is downloaded from the company, for the port account company. And I asked them to do a series of 8 different exercises, which will simulate what they will be doing in that airborne isolated environment. So for instance, I'll ask them to just start out with normal breathing, and they'll do that for a minute. And then they'll go into deep breathing for a minute. And then they'll do turning their heads from side to side. I'm checking to see if there's any leaks between their face and the N95 respirator. Then I'll ask them to, talk. I ask them to either read a poem or count backwards from 100. And then the only sort of physical exercise they have to do is then stand up and bend slightly for the waist. So I'm asking them to actually go below gravity. And then when they come up, they do normal breathing for another minute. So each exercise they do the exercise for 1 minute, and there's a second minute gap, which is particle counting. And that's the key. We do what we call quantitative fit testing, which deals with the aerosol ambient. So I always tell my clients, and I fit test my colleagues, the nurses, the medical officers. I've been doing the private sector, a lot of the general practitioners, the dentists. I've just completed the Bermuda Fire and Safety team. Also, some of the customs agents, officers. So anybody who is remotely going to be involved in any of the COVID-19 screening, they have to be fit tested to wear the N95 mask.
Well, nurse,
see why that's important. Yeah.
I was just going to say, this isn't the same individual who 5 minutes ago said she was nervous.
My presentation, we could have kept listening to that. That was perfect.
It's extremely.
Well, I owe it to you guys. It made me feel very comfortable. Thank you.
Well, thank you. It was easy to understand. It was very clear. We have live comments if anybody has any questions, but I think that was a pretty thorough explanation. What do you think, Aaron?
No, absolutely. So thank you. And we're going to move on, and we'll come back to you as the questions come in. But we appreciate that. That was extremely informative. And I know that I'm going to come back personally with a question, but we'll move on to get everybody their opportunity to tell us how this has affected. So, Ryan, I don't know if you want to take over at this point and ask Nurse Lambert a bit about.
Yeah, Miss Luz Lambert. Am I saying your name correctly?
Yes, you're saying my name correctly.
Okay.
Can you hear me out, or do you have some feedback? Because I hear feedback.
Still a little bit of an echo.
And your volume down. Put your volume down.
Okay.
We happen to be in the same room, but yes.
One thing I will say while you guys are working on that is not to worry, because we've had doctors on here, and we know that doctors specialize in medicine and healthcare. Ryan and I have a law background as we're completing our legal qualification, but we don't know anything about technology. And so we've had these issues. That's one universal issue that we've all found. So no stress, no problem. Hopefully we've been able to work it out. I know that you guys are 6 feet apart there, social distancing, but you work together as a part of a team. So it's natural that you're in the same room on 2 different devices. Hopefully we've got it sorted, and we'll let you take over now, Nurse Lambert, to tell us a bit about how this has, affected your line of work.
Absolutely. So, Ms. Luz Lambert, I have here that you're a registered nurse and you also deal with personal protective equipment training. So tell us a little bit about how you've been dealing with this. I imagine it's a stressful time for you.
Well, it's stressful. Is relevant. I think it's kind of become the new norm to have different roles when it comes to COVID-19. My general role with the Department of Health is as a community health nurse. And ever since we've had the recent pandemic, I functioned as the PPE facilitator. So when it comes, I work together with Dr. Armstrong to work on also infection control. So you're gonna go into So I have been primarily going over training staff, Department of Health staff, some of the nursing homes, police, we've recorded a couple of sessions. So kind of anyone that is out in the front lines on what personal protective equipment is required to treat patients or come in contact with patients or care for individuals out in the community, and to do it in a way that is safe, and have a good understanding on kind of what infection control is, how these viruses are spread from person to person, and what we can do as healthcare and as frontline staff to decrease the spread of the virus. So we've been really, really busy, but I'm happy to be part of an amazing team who are helping to stop the spread, decrease the spread, and hopefully stop it overall. We look forward to the end.
Well, we're sure you're doing great work with the personal protective equipment, as well as just as a nurse in general. And again, happy International Nurses Day. Mrs. Gaynell Hayward Caesar, the Chief Nursing Officer, how are you doing, and how are your fellow nurses doing?
Well, gentlemen, it has been an experience. This is something that we have been planning for as long as I've been at the Department of Health, which is 20 years now, for a pandemic. And unbelievable, we're here. And it's just amazing how things kind of fall into place. In preparing for the pandemic, we had to actually look at our programs and determine what were some of the things that we had to do to support trying to maintain a relevantly safe environment, and also to ensure that staff were deployed and redeployed in areas that they needed to be in to support. And some of these included, as Janice just said, performing the fit testing. The other was as well with fit testing and other PPEs that you're wearing. You also have to know how to wear it, when to wear it, and where to wear it. So that's where Luz came in with her personal protective equipment training. We have nurses at the airport for the Port Health, and they are the ones who meet the airplanes that come in, and to ensure that persons coming in are healthy, and also giving them directions and instructions regarding their quarantine. We also have the contact tracing team, which is operating out of the Appian surveillance unit. And those persons are tasked with doing the tracing for persons who may test positive, and being able to identify who are some of the other persons who may be at risk for either contracting or also infecting. We have also the central team of testing here on the site of the Hamilton Health Center, where we have a drive-in service for COVID testing, and persons come in, they have their tests and they roll out, and we then liaise with the lab. We also liaise with volunteers who actually have come on board to assist us in this. The other area as well is the actual call center, which is the center that was set up for a helpline for persons who needed to call in if they have questions or concerns. And what we noticed with the call center was whenever there was a press release taking place, the numbers of telephone calls following that really just surged. So that was definitely an area that was quite important and relevant. So we then have myself, who's part of a team responsible for the procurement. And that has been a task in itself, because as you can imagine, competing with the global market, where already the availability of personal protective equipment is very much a challenge. And so we have been, along with Dean Paris and Anthony Hunter, Siobhan Washington, part of a team that has really been looking out for the country, ensuring that we have adequate stocks. Some of our stocks have come as far away as China. We also liaise closely with Crown Agency, which is Public Health England, and they have also supported us with giving us supplies, that is for testing, for doing the actual test, and also swabs, and also for other personal protective equipment. So we have been extremely busy.
Yes.
Aaron, you're muted. You gotta unmute yourself.
Well, there you go. There you go. You guys have no reason to be nervous.
I could have let you go on for 30 more seconds, man. It would have been fun to watch.
But I just wanted to, particularly Nurse Lambert, with respect to the PPE and moving forward. For example, we know that COVID-19 is not something that's going to just pass when we get to phase 4. How long? What is the research right now as to, for me, for instance, I'm having to get used to it. If I go to the gas station and I want to go in and I forget my mask, it's a bit of a weird feeling that we're not to say that we're in prison, but the way our social interactions are certainly different now, because everybody's going, hey, do you have your mask? And if I put my shirt over my mouth, I said, that's not good enough. You need to go and get your mask and come back. So I say all of that to say, how long do you anticipate, or does the research say, for example, after we balance, this virus, if you will, are we going to have to be, doing that? Or is this our new normal?
We get that asked quite often, but it'll be interesting to see what kind of an impact this will have on kind of our social norms. There was a time where wearing gloves was considered very taboo. And I believe it was the HIV epidemic that actually brought wearing gloves with care a normal thing. So right now, when we see people with masks, it was kind of that, oh my God, they must be sick for a while. It was very kind of scary and very foreign. So it will be interesting to see what kind of an impact this pandemic will have on kind of what our daily interactions will be. Will it have impact on kind of how we greet each other or greet people that we don't know? But yeah, I think it needs to play itself out to see what kind of social norms will come out of this pandemic.
Yeah, it's just interesting. I mean, I ask everybody that comes on because, we discussed this new norm, and I would hate to think that is, what we're going to have to do. I mean, if we have to do it, that's the reality of the situation. So we'll be guided, and I'm grateful for that. We'll be guided by the science. We'll be guided by the data as the situation unfolds. But how is that, for instance, for nurses? You seem very jolly and happy, personal people.
Yeah, I'm a bit confused, Aaron, because I have this image in my mind of working overtime. I mean, some of the restrooms have been head staff reallocated. To me, you very far.
If this is the face of nurses in Bermuda, I'm certainly pleased. I know my experience with nurses is limited to the few times that I've had to go to the hospital or medical clinic, and then a show like Grey's Anatomy, if you will, where you have these high stressed environments. So I know that you are stressed out. I know that this is an unprecedented event, but you're certainly not giving us that impression here on the show.
We're seeing balloons. I mean, I'm waiting for the cake to come out, Aaron.
That's the party. That's
Yes.
the party. As Chief Nursing Officer, I wanted to recognize the nurses for their outstanding and their selflessness, working very hard, not grumbling, sometimes at a moment notice, having to change to be doing something else. So their flexibility and also their dedication and compassion for our community has been just top notch. So as a result, today I hosted a luncheon for them, which really shows some of my appreciation for what they do and also for who they are. They, as professionals, they carry themselves really well. So you won't see the frustration, you won't see the irritability. Um, However, when they go home at the end of the day, I don't see what they look like either. But you know,
Maybe we've
um,
got some
it,
family
they,
members sitting at home.
so that's what we do as professionals. We keep it together. And during those quiet moments and those times of reflection, that gives us the opportunity to certainly, come down and to really get some time to reframe and to feel better and then go back the next day for more. So, we really, as nurses, have a special calling, and you can always tell the difference between a nurse and a nurse. And for the A nurse, those are persons who are really passionate about what they do. They're compassionate. They're not there just for the pay. They go beyond that. And those are the persons at the front line who have been dedicated, working tirelessly, shedding lots of tears, perhaps even shaking in their boots at the fear, and also concern for the patients that they are providing care with. We, during this time, have been faced with death. We've been faced with very seriously ill persons. And these persons are in hospital alone and they're isolated. This whole disease is about isolation. It's a lot of psychosocial attachments to this disease that I don't think any of us fully were prepared for or fully understood that would become the norm. And so, there's guilt if I come down with a positive result. There is anger, there's frustration. Then you have your family who are very concerned and perhaps don't even want you to go to work. So those are a lot of the psychosocial emotions and attachments that we face on a daily basis. For those of our colleagues at the hospital, as chief nursing officer, I really wish to thank them for being the brave warriors that they are on the forefront, providing the care that each and every one of those individuals require, and also for the families to know that they are in good hands. When they cannot be there, we stand in the gap.
We can absolutely see. I mean, despite all the smiles, there's no doubt in our minds that you're all working very hard, tirelessly. And so definitely thank you very much. And I definitely share your sentiments with that message. Now, Aaron, you had a question about fit testing. Did you want to go ahead and go transition towards that?
Yeah, before I do, again, I just want to piggyback on what you said. And again, on behalf of us as the host here on the Bird News COVID-19 special series, one of the things that we look to discuss here is, the impact that COVID-19 has had, and we're looking, we've transitioned now that we've had a few weeks of, I think it's been over a month of having the shows of, forward looking and saying, well, how can things change? But the reality of it is, for many of us in society, as is evidenced by the doctors and the nurses such as yourself who are on the front lines, you can't look to 6 months from now, right now, because you're dealing with patients that are right in front of you, so we have to, we have a great deal of gratitude, not just Ryan and I, but Bermuda as a whole. That is not forgotten, and again, we've talked about, for example, some employment things where, some people have the benefit of, well, if you can work from home, work from home. Nurses don't have that, luxury, in their profession. Arguably, though, that speaks to your passion and, the care that you have for patients, because that's why you signed up to be a nurse, is because you do care for people. So saying all that to say thank you, and I think that it's a timely, interview, that it is International Nurses Day to have you all on. So thank you for that time there. Nurse Janice, just coming back to you on the Fitbit testing.
Yeah, it sounds like you need to do that presentation one more time.
No, so when we talk about the fit testing, rather, sorry.
Okay, that's okay.
What level has that increased or decreased because of COVID-19? Is it something that you're seeing a need for more?
Oh, most definitely. Because as I said in my little spiel earlier, I'm actually the ones that's responsible for the N95 mask distributions, or saying that you, Ryan, or you, Aaron, fit for 1870 plus or 1860 regular. And those are different types of masks. So one thing that I've seen since January is that because of the COVID-19, there's been an increased need because of screening for the COVID-19, because of my colleagues in the hospital, and they also do fit testing at BHB at King Edward, that there is an increased need. The downside of it, though, unfortunately, is because there's a global shortage of N95 masks. So on a good day, pre-COVID, I would have, say, 3 to 4 different types of N95 respirator masks that I could use on an individual. But because of the global shortage, I only have 1, sometimes 2 N95. So definitely if I have to fit test, like you're both males, I would tell you right now that I don't have a face filtering mask that will fit you, because both of you have facial hair. So what my recommendation would be, if you had to go into that airborne isolated environment, would be to use something called a pepper hood. And that's a powered purified respirator mask, which is actually a hood. It fits over your head, and it has a battery pack that's attached to it. So instead of you seeing the N95 mask like that, you would actually have a hood that comes down, completely covers your face, and then it's attached to a breathing tube and a battery pack. And then you get that purifying air coming through that. And, that will cause you to not breathe in the contaminated air.
That's very interesting, because who would have thought? I mean, Aaron, I don't know about you, but as somebody who just studies law, I would think, okay, we need masks, just get some masks. But what you're saying is yes,
I cannot, or my boss or the people at the hospital cannot just say, Aaron, put on this 1870 plus and go into that airborne isolated area. I would have to fit you for it. And like I said, it would be to see the perfect seal that it would make between your face and the mask. But with the both of you, you both have facial hair, so you either have to shave, and it's like asking me to cut my hair or to shave off my eyebrows. We don't do that. So you would automatically, I would say, get out. I'm not fit testing them. I'll just show them how to do use the pepper hood. And the same goes for King Edward, because in the meantime, we are working on different policies for our respiratory protection program. We need guidelines. We are using those from OSHA, Occupational Safety and Health Administration in the U.S. And we do have a occupational health and safety officer at the Department of Health who we're working along with. So with everything, we have to develop guidelines and policies, but because of the COVID, it was like full steam ahead. There's also different requirements that should have been done prior to fit testing, like getting a medical clearance. So again, Ryan or Aaron, if you were to come to me for a fit testing, you would need prior medical clearance from your physician. But because of the COVID-19 and because of the seriousness of your job, we've I don't want to say we've omitted that part, but we know those that we can safely say, I always ask, do you suffer from claustrophobia? Because there are some individuals that cannot be in that face mask for more than 5 minutes. And I test them. I make sure that once I get them on the machine, they don't know one tested them, but I'm actually giving them about 3 to 5 minutes. Most guidelines say the individual has to be on, have the mask on for at least 3 to 5 minutes just to check for any claustrophobia or any other sort of respiratory illness that might be going on with the individual. So it's a lot. It's really, really a lot. But I've been doing fit testing for the last 8 years. I'm new to the Department of Health. I've been there. I've just celebrated my 3rd anniversary. Again, now it feels like I've been there 15 years. But I came over from King Edward. I was in employee health. So I gained this knowledge and this skill. And thankfully, I'm able to put it to good use. Because normally I will work in the communicable disease clinic upstairs of the Victoria Health Clinic. That's where I was hired to work. But since January, I've been redeployed to do the mass fit testing, which has been my absolute pleasure because I've come across a wide range, a variety of people, those frontliners who, you know, like you said, put themselves out there every day. So my job is to make sure that I fit them the best to my abilities, to know that once they go out there on the front line, I know that they're using the mask, the same make and the same model that I've fit tested them for. And that's also very important. If I fitted you for 1870 plus, you cannot use anything else besides that 1870 plus and 95 respirator mask. If you do, then you're doing it at your own risk. And I make that very clear as well.
Mm-hmm. Well, Mrs. Nurse Seeley Khan, it definitely sounds like you're passionate about what you do. So thank you very much for that presentation. We're going to ask, I have one more question for Nurse Lambert, and then we'll begin to wind down. But before we do that, Nurse Seeley Khan, we had a question from a member of the public. Claire Ann Rayner asks, what do you recommend for people that are asthmatic?
Okay, well, thank you, Ms. Claire Ann. That's a very good question. And this all comes a part of the medical clearance that I had just spoke to, that, like I said, with all the guidelines and the recommendations from OSHA, that one should be have a medical clearance before they do a fit testing. But the masks that we use, the N95 masks, do not have any allergies in it. So a person really, for their asthma, it doesn't have any sort of material in that should trigger their asthma, if that's what she's concerned about.
Okay, well, that's great. Thank you very much for answering that question. Nurse Lambert, one more question for you. What is the PPE training like? We know that you're managing the personal protective equipment training. Can you speak to that a little bit?
So yes, actually the PPE training is a 2-part training. We always say that PPE is the easiest to implement. Everyone wants them. Everyone wants those great masks that Janice is fitting everyone for. But realistically, it's ineffective if you don't understand kind of infection control. So our first part of our training is infection control. Initially, we were doing it in our facility, but because of social distancing and of course the increased demand, we recorded our infection control portion of it. And it's just a video that goes over kind of transmission, the chain of infection, kind of what links are needed within. There's different links that we talk about that are needed for a virus or bacteria to get from one person to another. And it's really important for us to understand how viruses get into our body, how viruses get out of our body, how they can make it to the next person. That part is most important because we can give everyone a whole pile of PPE. And if you don't understand that portion, what actually personal protective equipment becomes is a vector. It becomes an increased risk of contamination. So our first portion is infection control. And then the second portion is actual PPE training, where we go over donning and doffing, which is putting on our personal protective equipment and taking it off, and how to properly do that without contaminating ourselves. So that portion is really important. I will touch kind of on the N95 masks. They're really good masks. They're everyone wants them. They're kind of like gold now. But realistically, you only need an N95 mask if you are performing an aerosol generating procedure, and that would be a nurse treating a positive patient, and they were performing a procedure that causes small particles, not in our infection control video, we talk about droplet precautions and aerosol precautions. So when we talk about droplet precautions, these are droplets that are generated in normal speech. We have a joke in training that you can tell droplets that are generated when you come across people who stand too close to you and you could see those droplets flying out. Those are, when we talk about droplet precautions, those droplets are what contaminate our surfaces. But you don't, if you social distance, you can get away from those. But you only need an N95 mask if you are treating a positive patient and you're performing a procedure that causes smaller particles. These are particles that are aerosolized. They travel a longer distance. They're suspended in the air for a longer distance, a longer time. And those actually require an N95 mask to be filtered. So, like I said, personal protective equipment right now is in high demand. We see individuals out in the community driving with their gloves on and their masks. And it's really important for them to understand that hand hygiene, good hand hygiene is vital in breaking the chain of infection and limiting transmission, limiting contaminating surfaces. So right now for an individual out in the community, a homemade mask is what's being required. And the idea with a homemade mask, we hear all about individuals saying, well, should we have this filter in it? What kind of material should we make it out of? Really, the purpose of a homemade mask is to capture those droplets that I was talking to you about, those droplets that are generated in simple speech. Those droplets contaminate surfaces. And if I have a mask on, when I'm talking, I'm not contaminating surfaces. The person next to me that comes after me, won't have a contaminated surface to put themselves at risk. So if with good hand hygiene, you don't need gloves to perform regular everyday activities, that's really important. So I will say that one of my challenges with PPE training was really, it wasn't just to teach people how to put it on and take it off. It was really educating people on kind of how viruses are transmitted and what we could do to break that chain of infection, because that's more important than putting a whole pile of personal protective equipment on.
Absolutely. I mean, it sounds like there's so many moving parts to this. You have to get the mask and get the equipment, but then you also have to educate people on how to use it, how to take care of it. And then when they take it off, how to clean it and sanitize it and do whatever else they have to do. So, I mean, you sort of touched on it. I was going to ask, as we begin to wrap up, if you had any final parting words for the general public. So unless you had anything to add, Nurse Lambert, then we could just go back over to Nurse Seeley Khan, and then Ms. Gaynell Haywood Caesar, for some parting words.
Mm-hmm. No, I think I unless anyone has any questions, like I said, for the general public, really, I can't stress enough washing your hands and washing your hands for 20 minutes, using good hand hygiene, scrubbing, using good friction, making sure you get those areas that are often missed. We often missed our in between our fingers. Often missed, which drives me crazy, is our fingertips. People don't think about the dirtiest part of our hands, the area that we use the most. that will be most contaminated is our fingertips. We use it to touch our screens. We use it to touch our computers. So kind of making sure that you cover all areas of your hands. So using a good bit of friction, covering those areas that can often be missed. So in between your fingers, the tips of your fingers, your nail beds. So getting your nail beds, your thumbs, and finishing off with your wrists. So I think that's really important. So if we can stress to the community, if I had one good tip for the community, it's perform good hand hygiene and do it frequently.
Thank you very much.
And it really decreases the spread.
Thank you. So Nurse Seeley Khan, and then after that, we'll have the Chief Nursing Officer.
Yes, thank you again, Mr. Ryan and Mr. Aaron, for having us on. And I would just like to piggyback on what Nurse Luz said, that hand washing is the key as far as fit testing is concerned. I'm in an area where it's not easy for me to get to, the sink and soap and water. So I have the alcohol rubs. So again, I'm always reinforcing hand sanitizing before you put on your mask. And then again, I didn't say, but I do spend at least 3 to 5 minutes on the proper placing and taking off of the N95 mask. And then again, stressing hand sanitizing after they've taken off the mask. So again, just to piggyback on Nurse Luz, that N95s are like gold. I've seen a lot in the supermarkets. People are out. I don't know where they're getting it from, but I know our manager, Ms. Gaynell Haywood Caesar, has been doing her best to procure from Public Health UK and other areas, other jurisdictions. And I like to take my work home with me. So if I see someone in the supermarket that's not wearing their mask correctly, I always go up, maintaining my physical distance, and say, "Excuse me, your mask is not on correctly." Having a mask on incorrectly, it's better for you not to have the mask on at all, because it definitely is a skill. The person needs to be trained for it. But again, like Nurse Luz says, it's not something that you have to wear every day to the supermarket. A simple face covering is suffice. But thank you again for having us.
Thank you. So lastly, we'll have Mrs. Gaynell Haywood Caesar, who is the Chief Nursing Officer. Do you have anything else that you'd like to say to the public?
Yes, Aaron, and also
Ryan.
Missed your name for a minute. Ryan, yes. We never imagined that 2020, which was earmarked the year of the nurse and midwife in celebration of contributions by our profession, would occur during a great pandemic. This year's ICN theme, Nurses, a Voice to Lead, Nursing the World to Health, has a whole new meaning. It is fitting that nurses and frontline workers are celebrated on this day during this month of nurses celebrations and during this year for their unselfish, compassionate care. They are truly the heroes who will be recorded in the historical annals of 2020. Some have given their lives, suffered physical and emotional exhaustion, stricken with grief, and also a sense of helplessness. But they've graciously been redeployed to nurse in makeshift wards and nursing the most vulnerable who have become socially distanced from their families. In this battle, situated at the front of the pandemic battlefield, we stand in the gap as family for those riding in the ambulance, at the COVID-19 ward, in the nursing care homes, at the shelter and quarantine centers, providing that human touch, that soothing voice, and giving comforting reassurance that they will never be alone. As Chief Nursing Officer, I wish to thank each of the nurses and nurse associates who deserve a standing ovation for doing an outstanding job in nursing the world to health. Continue to be the voice for the voiceless and lead the cause for universal access. Be encouraged, but most of all, stay vigilant and safe in this COVID war. I appreciate your meaningful contributions, the pictures, the stories, acknowledge your deepest fears. I see your tears and stand beside you in celebration this year. Today is more than just another day in the life of a nurse. There are many unsung heroes, but two nurse leaders who have been fighting on the nursing care home front line, Roshina and Angela, along with their teams, I wish to recognize them. Thank you to Judy Richardson, the BHB Chief of Nursing, for her support. And nurses, most of all, thank you all. You really rock. Be the voice to lead. And Nurse Bermuda back to health. Thank you.
Thank you.
Thank you very much. That was a very beautiful message. So thanks again. We've had a very nice, heartwarming conversation today. Definitely lit up the room, all of y'all's presence. So thank you very much for joining us and taking the time out of your busy schedules. Happy International Nurses Day. And thanks again for all your hard work. So once again, for the general public, that was Mrs. Gaynell Haywood Caesar, the Chief Nursing Officer for Government from the Department of Health. Mrs. Janice, is it Janice or Janice?
It's both, but I prefer Janice.
Okay, Janice Sealy Khan, registered nurse, fit testing, Department of Health, and Ms. Luz Lambert, registered nurse, personal protective equipment training, Department of Health. Thank you all very much, and have a pleasant afternoon.
All right. Thank you for having us.
Thank you. Thank you for having us.
Ryan, we've had a full day.
We definitely have, but that was a very that conversation just kind of lit up the room as far as I'm concerned. It was very nice to see the nurses, despite all of their hard work, and I'm sure they're all tired, to just come and put a smile on everybody's face and sort of brighten up our day. So thanks again to all of those nurses for joining us today.
Absolutely. As I said, we've had a full day. We had Dr. Brathwaite from the Health Council, the CEO of the Bermuda Health Council, come on board. He gave us near about an hour of his time, so we're grateful to him. Thank you for your time and the candid responses that he provided. And thanks again to the nurses. I thought that it was very timely to have the nurses on International Nurses Day. Again, we'd like to express our gratitude to them and all the essential workers who are on the front lines.
Absolutely. So we're going to wrap up for today. I think we've had a pretty full day, like you said, with two segments of guests. Thanks again to all of our viewers. Thanks for joining us. We're looking forward to continuing this series every Tuesday and Thursday on Berners, the COVID-19 special series. So thanks, Aaron. It's been great today. And thanks to all those who joined us. We'll see you next time. Thanks again to all our essential workers. We send our condolences to those affected by the pandemic thus far, and we wish you all the best.
Take care.